Different classification systems like Parkinson Plus Syndromes, like Fronto-Temporal Dementias are used to classify the same disorders, and it can get really confusing. For example, if you're reading about Progressive Supranuclear Palsy, some place it will say it's a Parkinson Plus Syndrome, and then at another place it could say it's a Fronto-Temporal Dementia, and you really get confused. Hopefully in this video, you and me can both get some clarity around this. So let's just quickly look at Parkinson Plus Syndromes, Fronto-Temporal Dementias, Tauopathies and Synucleinopathies. A lot of disorders which are classified under these headings overlap with each other. So I thought it would be good to make this diagram, which hopefully makes it easier to remember where the overlaps are. It's actually good if we know the different ways in which these disorders are classified, which I'll just go into in a second, because just by knowing these classifications, we still stand the chance of having a better idea of what the disease looks like. If you look at the Parkinson Plus Syndromes, we've got 4 there: Progressive Supranuclear Palsy, PSP, Corticobasal Degeneration, CBD, Lewy Body Dementia, and Multisystem Atrophy. So if then you look at Tauopathies, so there's lots of Tauopathies and I haven't listed all of them here. So you can see PSP is there, CBD is there, and then you've got Alzheimer's, you've got Down syndrome, and you've got Pick's disease. So what that tells us is that PSP is a Parkinson Plus syndrome, but it's also a Tauopathy. Similarly, CBD is also a Tauopathy and a Parkinson Plus syndrome. Then if you go into Fronto-Temporal Dementias, again you see PSP and CBD are there. So these 2 disorders are actually classified in all 3 of these classifications. And these classifications are quite different to each other in the way they classify these disorders. So Parkinson Plus Syndromes is a classification based on the clinical presentation, it's kind of a functional classification, if you would, on how the patient presents. So they will have Parkinsonian features. That's common in all the Parkinson Plus syndrome. For example, if someone asks you what is PSP and you remember it's a Parkinson Plus syndrome, you already know that it has Parkinsonian symptoms. Now, it's also a tauopathy and also a frontotemporal dementia. Tauopathy is more of a pathophysiological classification because it's going down to the actual biological problem, which is the accumulation of this tau protein, which kind of stabilizes the microtubules. So that's kind of going deep into the root of the problem at the histological biological basis, and that's why it's a tauopathy. And just by knowing that it's a tauopathy, you will have some idea of what the disease is. It's also a frontotemporal dementia. Now, frontotemporal dementia, as the name implies, it's a more of an anatomical, a structural classification. So frontotemporal dementias would be dementias in which the frontal and or the temporal lobes are affected. And again, these 2, PSP and CBD, are frontotemporal dementias as well. So just by knowing these 3 different classifications of these disorders, we already know something about it without actually having read or gone into details of exact disorder itself. So I always start with this because I think it's good to first have context around it, so you know where to place it in the grand scheme of things, and classifications are good for that, and they also give you information. Even if you forget everything else, you know something about the disorder. We've talked about PSP and CBD, and then the next 2 Parkinson Plus syndromes are Multisystem Atrophy, which actually has further types. I'm not going into detail of that. And then Dementia with Lewy Bodies. So Dementia with Lewy Bodies is a synucleinopathy. So pathophysiologically, there's a problem with alpha-synuclein protein. So it's a synucleinopathy. Similarly, multisystem atrophy is also a synucleinopathy. We know Parkinson's disease is also a synucleinopathy. And if we go into the frontotemporal dementias, we've already covered PSP and CBD. If you look at Pick's disease, which is a behavioral variant of frontotemporal dementia, again, it's a tauopathy. Then you've got some other frontotemporal dementias, which I've just mentioned, which is like primary progressive aphasia and amyotrophic lateral sclerosis. Frontotemporal dementias is a long list of disorders. So is tauopathies, so is Parkinson Plus. Arguably, synucleinopathies aren't that many. I mean, like, there's only 3 main ones, but they overlap with each other, and it's a good idea to know where a disorder stands within these classification systems, because that in itself is useful information to have.